Did you get from the doctor? Can you tell me what you take?
Oh dear. Can't always remember their names.
Oh, well, just try your best.
There's the white ones for the fluid, and there's the orange ones that go with them, of course. And there's the tablets I take for my arthritis.
Arthritis, yes.
I think they've got an F in the name, but I just can't remember.
You can't remember the name of them or any of the strengths, you know, you can't remember. I really need some more details. If you could remember the names of some of these tablets, it really would be a help.
No, they've got such long names. It's so difficult.
Oh, well, never mind. I'll just have a look at your chart here. And well, I see you're taking some frusemide. That's the one for the water, and it's okay. They're the orange ones. And there's some little blue ones that you take for your heart. That's the digoxin, yes, yeah. Anything else that you take?
Oh, there's the little footballs. I need 2 of those to help me sleep at night. I don't get a wink of sleep without them.
Well, I don't really think you should be taking that. I find it hard to believe that you can't sleep without any tablets, so we might look into that while you're here. Now, the tablet that you take for your arthritis, that's most likely brufen. It's a sort of a pinky red colour, and you take that 3 times a day. Does that sound right? All right, well, I'll talk to the doctor about that one, and we'll get him to write it up for you so you don't miss out on that one. He hasn't put it on your chart, so I'll take care of that. Now, he's put you on some new tablets. There's one called amiodarone, yes. That's for your atrial fibrillation, you see, to try and keep your heart going regularly. And there's some warfarin there that'll keep your blood thin, stop any blood clots from forming. There's a few side effects I'll need to tell you about with regards to those. The amiodarone, it's photosensitivity and can get some hypo or hypothyroidism. There's a few side effects you probably need to know about that, and there's a few interactions there that can interact with cardiac glycosides and cause some fairly severe toxicity. So I probably need to talk to the doctor about those, and there's a few things I need to tell you about the warfarin too, but I'll come back and talk to you about those. Now, is there anything else you can think of while I'm here? No, well, I'm usually round about in the ward, you know, from time to time, so if you see me wandering around, just grab hold of me if you've got any questions, and I'll fix all of those things up that we talked about, and then I'll come back and talk to you later. Oh, hello, I can see the doctor's coming on the round now, so I'll just get out while the going's good. Bye.
Bye.
Hi there, Mrs. Smith. Hello, how are you settling in?
Fine, thanks, dear, but could you tell me, who was that woman?
Right. Dear Doctor, you silly nong, Mrs. Smith takes brufen and temazepam to sleep. Please write them up. If you'd done it in the first place, would have saved me a lot of trouble. And there's no strength on the isoptin. That'd be a bit of a help. Cheers.
Wonder when low fat's going to get fixed. Hi, Sylvia.
Oh, g'day,
How are
mate.
you?
Good, thanks.
The new lady, Mrs. Smith. Have you got her in here?
Yeah, she is.
What
She's
bed's she in?
actually Bed 20, just down by the window.
Bed 20. Okay,
Yeah.
there's nothing in there. I'm just going to go and say hello to her, okay?
Okay.
Hello, Mrs. Smith. Yes, my name's Much Smarter. I'm the pharmacist on the ward. I just wanted to have a bit of a talk to you about why you're here and what sort of tablets you take.
Yes, dear.
What's brought you into hospital today?
Oh, well, I've been having these falls, and the doctor says I've got this funny heart rhythm that's making me have these falls.
Right. Now, are you on some tablets at home normally, Mrs. Smith? Can I call you Flossie?
Of course you can,
Flossie,
dear.
okay. I'm Much.
Hi, hello, Much.
Okay, so do you take some tablets at home?
I do take some tablets at home.
Do you know any of the names of them, or what they look like, or how many you take?
Well, there's the white one for the fluid.
Right.
And then of course, there's the orange ones that go with those as well.
Right.
There's the tablet that I take for my arthritis. I can't remember the name.
That's okay.
It's got an F in it.
Oh, okay, that's a good help. Just tell me whatever you can remember. Did you bring your tablets in with you from home?
I'm sorry, dear. Things
Okay.
just happened so quickly.
I'm sure you had other things on your mind when you came into hospital. That's okay. Do you go to one pharmacy to get all your medication, or is there someone I could ring to find out what you normally take?
Well, if you could, that
Yes.
would be
What's the name
wonderful.
of your local pharmacy?
I go to Mr. Snodgrass in the mall.
Oh, okay.
I've been seeing him for years.
Mr. Snodgrass. Well, I could give him a call and we could check up some of the details and make sure we've got you on everything that you need to.
Mm-hmm.
Now, is there anything else that you get? Do you buy anything without a prescription, or do you use any puffers or eye drops or anything else like that?
Oh, well, there's the my bowels are terrible and
Okay.
I need Newlax. I
Newlax,
really do need
okay.
to take it
Yep.
every night. And those little footballs to help me sleep.
Okay.
I don't get a wink of sleep without two of those each
Two
night.
of those, okay.
And I forgot, there's the eye drops.
Oh, okay.
What are they called? Timotay or something
Oh,
like
okay. Now I can check the details of those with your local
that.
pharmacy
Would
as
you
well.
do that? Would be so good of you.
All right, so there's a few things we need to get sorted out on here. I'll have a bit of a chat to the doctor and we'll make sure we get all of those things written up for you. Some Newlax and something to help you sleep and the eye drops. And I'll check about the details of how many you take with your local pharmacist. Just with the tablets you take to help you sleep, we might have a bit of a chat while you're here about other ways of helping you get to sleep without taking tablets. How would that be?
Yes, that would be fine.
It's probably not a good idea if you take sleeping tablets all the time, but we won't worry about that too much for the first couple of days while you're here.
All right.
Now, while you're here, I'm going to come around and see you every day, and I'm going to have a look at your drug chart, and we'll have a bit of a talk about the medicines that you're on. So if you've got any questions when I come round every day, you feel free to ask me, and I'll be giving you some information about some of your new tablets. Now,
I've got new tablets.
you have, yes, and I think it's because you've been having some funny problems with your heart. The doctor's put you on a couple of new tablets. One of them's called amiodarone.
Oh dear.
Yes, it's a long name. And that one's to help keep your heart rate regular. Okay,
I
to
see.
stop it fluttering.
I see.
And the other one that he's put you on is called warfarin, and that one helps to stop clots forming, helps keep your blood thin.
Oh.
Okay, now there's quite a lot of information that you need to know about these two tablets, but I won't tell you too much about it today. I'll bring you a little book to read about your warfarin, and then every day we'll have a bit of a talk about it so you can learn a little bit more each time. How does that sound?
That sounds wonderful.
Have you got any questions about any of the things you're on at the moment?
Not that I can think of.
Okay, well, like I said, we'll come back and have a chat. Now, there's just one more thing. Is there anything you know of that you're allergic to, or anything that you know that you're not supposed to take?
No, I don't think I've had any problems in the past.
Okay, good. Well, if you think of anything else, I'll be back a little bit later. I'll go and ring Mr. Snodgrass, and then I'll have a bit of a chat to the doctor, and I'll see you later.
Oh, thank you.
Okay, thanks, Flossie.
Bye.
Bye. Snodgrass. Yes, it's much smarter here. I'm the pharmacist at Chicago Dope Hospital. Yes, I'm just ringing because we've got one of your regular customers as a patient at our hospital, and I'm ringing to see if I can get some information about her medication. It's Mrs. Smith, Flossie Smith. Yes, that's the one. Can you just tell me what medication she takes? Right, okay, Feldene, right, and they're 10 milligrams daily, yep. And the Verapamil? Oh, slow release, 240 milligrams, okay, just one a day, yep. Tomase, yeah, 20 milligrams at night. And the Timolol, 0.25%, good, okay. Twice a day, yep. And the Digoxin, 3 of the PGs in the morning. Okay, Lasix 40 milligrams morning and midday. And the Slow K, 1 BD. And that's all? That's great. Thanks very much for your help. Bye. Ivor?
Yeah, much.
Are you the doctor who's looking after Flossie Smith, the new lady?
Flossie in 20?
Yeah.
Yeah, I admitted her last night.
Yeah, I've just got a few questions about her medication. I rang the local pharmacy just to find out exactly what she's on, and there's just a few details I hope we could sort of clear up. Just with her amiodarone and her digoxin, I'm a little bit concerned about the dose that she's on, and because the amiodarone can increase the levels, are we going to send off a digoxin level and maybe think about reducing the dose?
Yeah, I was going to do that, yeah.
Yeah, okay, that'd be good. And the other thing with the amiodarone, if we send off some thyroid function tests, if she's going to be on it long term, we probably want to get a baseline.
Yeah, I was going to send those off at the dig levels.
Yeah, okay, that'd be really good. And the warfarin and the amiodarone, you probably know that the two of them can interact, so we're going to have to keep a fairly close eye on her warfarin for the first couple of weeks because the effect can take a while the interaction can take a while to happen. So when she goes, she'll have to have some pretty close follow-up with her warfarin.
Okay, I gave her 10 milligram last night, right up to 10 tonight.
Yeah, that's good.
All right?
Yeah, that's good. Have you got a copy of the guidelines that have come out for anticoagulation?
Yeah, I had them somewhere with guidelines where they are now.
I'll get you another copy if you like, but that should be fine. The other thing is she's got some arthritis and she normally takes Feldene, but they're not going to go too well with her warfarin. So can we have some regular Panadol for her?
What, strict Panadol?
Yeah, probably. She's in a little bit of pain, so that would be really good. There's a couple of other things that she normally takes, but I've written all the details in her history. If you can have a bit of a look and think about adding them to the chart, that'd be great.
Yeah, sure.
Terrific. Thanks very much for that.
That's good, mate.
Okay.
Thanks.
I just spoke to Ivor about Mrs. Smith, and there's been a couple of changes with her medication. The main thing is the isoptin she takes is one of those slow-release tablets, so I'll get some of those for you, but make sure you don't give her the normal ones. I think that's what's in the drug trolley at the moment. So